Welcome back, Dr. Linda here. Let's take a look at the pancreas. The pancreas is considered to be a mixed gland because it has endocrine and exocrine functions. So most of the pancreas is exocrine. They say between 80 and 90% of the pancreas is actually made up of exocrine cells, and they are arranged in these clusters that are called acinar cells or acini cells, and they are going to be involved in producing digestive enzymes. They're scattered among the acini cells are going to be endocrine tissues, and the endocrine tissue are called pancreatic islets or islets of Langerhans. And these islets of Langerhans do contain secreting cells. The alpha cells secrete glucagon, the beta cells secrete insulin, the delta cells secrete somatostatin, and the F cells produce pancreatic polypeptide. So when we talk about blood sugar, we're talking about the relationship between these alpha cells and the beta cells primarily. So here's this kind of like seesaw here in the middle, and we have something on the left. Perhaps you just had ice cream, or you had a soda, or a high refined carbohydrate sugary meal, and you have something that's created a hyperglycemic effect. You have high blood sugar, high blood glucose levels. So the beta cells of the pancreas sense that, and the beta cells release insulin. And insulin has a way of lowering blood sugar. How? Well, it can take some of that sugar and store it in the liver. It stores glucose in the form of glycogen. Remember, O-gen is inactive. And it can also create uptake by cells, right? So these cells have doorways that will allow sugar to go inside. And if sugar goes inside, because it exited or was able to leave a blood vessel, it went from your blood vessel, this is a blood vessel, which had hyperglycemic, high blood sugar. Now it moved into the cells. Now the blood sugar in the blood vessel went down. Okay, so now it went all the way down. Blood sugar falls to normal range, or it dips too low. Maybe insulin was being pumped out too long, and now we have too little or declining blood sugar. That too is going to be picked up by the pancreas, but this time it's picked up by the alpha cells. And the alpha cells are going to push out glucagon. Glucagon goes to the liver, and it takes the stored glucose, which is called glycogen, and it says, glucose be gone, right? And it pushes glucose out of the liver, and your blood sugar can go back to normal, or it can go too high again. So you have these two, you have the pancreas and those two cells, the alpha and beta cells, working together to regulate blood sugar. When there's dysregulation, this is what we call diabetes mellitus, and it results from either a hyposecretion of insulin or hypoactivity of insulin. And typically there's three cardinal signs. We call it the three Ps: polyuria, polydipsia, and polyphagia. Polydipsia is when the person is excessively thirsty, and if they're drinking lots of water, then they get polyuria, which is increased in urination. And polyphagia is excessive hunger. So they get these three Ps with diabetes mellitus. Hyperinsulinism is when there's an excessive release or excessive secretion of insulin. Now, if your body is pushing out too much insulin, that can result in your blood sugar going too low, which is hypoglycemia. This is why people who take insulin injections have to regulate and monitor their blood sugar, because if they take too much and it dips, hypoglycemia, could be a very, very deadly issue. There are people who have been pulled over by the police who went into hypoglycemic shock and they think they're drunk because the brain can't function when the blood sugar dips that low. Okay, when we come back, we'll talk about some of these sex hormones and some miscellaneous hormones.